Living in the verdant hills of Kinyababa is Ngaboisonga Alexi, a middle-class native whose livelihood is centered around planting Irish potatoes and raising pigs. Ngaboisonga gets up at 5 a.m. every day to look for grass, food leftovers, and water for his pigs to eat and drink. Due to a lack of clean water, Ngaboisonga will fetch water from the Rugezi River, which is constantly polluted by animals such as sheep, goats, and cattle, which defecate in the running water. The pigs drink this water, which contains hazardous chemicals and parasites that can cause diseases when crossing animal-human borders. Since there are few slaughterhouses in the area, Ngaboisonga always asks his neighbors to buy pork from his home, where he slaughters his pigs and sells them without inspection. However, he is unaware that eating meat which is not inspected jeopardizes people's lives who feed on it. By this time, the water he drew from the Rugezi River had been infected with Salmonella enteritica, which had gotten there from animal feces. This bacterium causes a disease known as non-typhoidal salmonellosis. In other cases, non-typhoidal salmonellosis can be caused by Salmonella typhimurium. It is a disease that affects animals and people and can spread via fecal-oral routes. It is a zoonotic disease with many reservoir species in the families of mammals, reptiles, birds, and amphibians. According to the Center for Disease Control and Prevention, CDC, it has an incubation period of 12 to 96 hours. It is characterized by diarrhea, stomach pain, fever, and nausea. When the bacteria spread beyond the digestive system into the bloodstream, it can cause gastroenteritis and bacteremia. This disease is fatal, and according to the National Institute of Health, this disease causes 93.8 million cases and 155,000 deaths worldwide each year. Unlike other waterborne infections, which are usually prevalent in less developed countries, non-typhoidal salmonellosis is found in developed and developing nations. According to the National Center for Biotechnology Information, this infection is the second most prevalent zoonosis recorded in the European Union and European Economic Area, with 91,000 cases per year. It is a significant burden in sub-Saharan Africa, where it kills approximately 77,000 people each year, according to National Institute of Health. There is no vaccine for this infection. It is usually treated with antimicrobial medications, but the bacteria keep developing antimicrobial resistance. Going back to Kinyababa, Ngaboisonga's community is at risk of being infected if consumed contaminated meat, and the aftermath can result in the endemicity of this infection. What can be done to combat this disease? There is a need to increase food safety by inspecting meat that is sold to prevent the spread of these bacteria. Furthermore, more research is needed to find cure and vaccine for the disease. Non-typhoidal salmonellosis is a global burden that, if not addressed, might severely harm the world since the pathogenic bacteria are acquiring antimicrobial resistance, jeopardizing future generations. It is important to use One Health approach to strengthen the cooperation among environmentalists, human and animal health professionals in order to combat this disease.